It's hard for people to talk about these things, I find, because there's a lot of shame and stigma around depression, not so much around anxiety anymore, but around depression and around clinical anxiety and around psychosis for sure, which is super rare, but people don't really talk about these things when they come up. I do have a lot of people mention to me in prenatal yoga classes having some anxiety that they deal with, because anxiety is really just the human experience these days, I think. I think everyone who shows up to the yoga mat has some degree of anxiety. That is something that I see across the board, not only in prenatal yoga classes, but in every single class that I teach. Anxiety, I just see it everywhere. It's really common. It's the world we live in today. So that is the whole purpose of doing yoga, really. A big purpose is to provide people with tools to cope with anxiety. And everything in yoga helps with that. So I can't really say that there's one thing, because for different people, it's different things. But it's often the practice of moving slower, of being mindful with our bodies that can really help. Hi everyone, and welcome to the Coffee Witching Hour. My name is Lacey, and this is my podcast that is all about birth, yoga, and raising kind humans. And today we're going to be getting into kind of the third part of a 3-part podcast series that's all about teaching prenatal yoga. So if you have not already watched those first 2 episodes, I'll link them in the show notes or the description below. So check those couple out before getting into this one. The first one is on just an overview of general prenatal yoga modifications. And the second one gets into the 1st through 4th trimesters of pregnancy and how to best tailor modifications to those times of pregnancy and postpartum. Today we are going to be getting into some common things that come up during pregnancy and postpartum. So some common aches, pains, discomforts, and general, I want to say kind of medical conditions, although not all of these are medical conditions, but some things that go on in the body that are pretty common during pregnancy and postpartum. And these are things that I see a lot as a prenatal yoga teacher. So know that my perspective is just as a prenatal yoga teacher and as a doula as well. These are some things that I've seen with clients as well, but mostly these are things that have popped up as a prenatal yoga teacher. So know that I am not a medical provider, although I have some training in public health. I am not a medical provider, so I am never in the position to diagnose anyone or to tell someone that these suggestions are the way to go, especially if they are in opposition to what their medical provider may say. And so that goes for anyone who's listening as well who might be pregnant or who might be working with pregnant people. These are just some common things that I see pop up in my classes and some suggestions that I hear work from other pregnant people as well as ones that I've learned in my training. So this is a really good episode for anyone who is a yoga teacher and works with bodies in general, because pregnant people so often come into all levels yoga classes. So if you are a yoga teacher, you will be working with a pregnant body at some point. And most likely, the person who you work with is going to be experiencing at least one of these things that I talk about today, whether it's just something minor like insomnia or something bigger like preeclampsia. Very unlikely that kind of person is going to be coming to an all levels class if they have preeclampsia and are in a kind of preeclamptic emergency. But we as yoga teachers should feel equipped to understand the things that people are coming to our classes with and to know how best to work with them. Even if the safest thing is sometimes to say, this is kind of out of my wheelhouse. I don't know how to best serve you. I don't have any experience with this and I don't have much knowledge on it, but I want to learn with you. So let me know what works for you, because that's sometimes the truth. But listening to this episode will kind of give you a general overview of the common conditions that can pop up during pregnancy and how we can work with them as yoga teachers. And of course, if you are pregnant or postpartum, then this is a great episode for you as well, because a lot of these things that I talk about might apply to you. And so it's great to understand how to tailor our yoga practice to serve our needs in any given moment. As I said, this is my perspective as a prenatal yoga teacher. I have not lived through all of these conditions. Most of them I have not experienced myself, but I have worked with a lot of pregnant bodies in yoga class. So without further ado, let's dive right into this topic. Okay, so we're going to get into both pregnancy-related conditions and what to do if someone who is, quote, high risk. So those people whose pregnancies are seen as I hate this term. I hate the term high risk because it makes it sound like being in a pregnant body that is high risk is dangerous. And my first pregnancy was extremely low risk and ended up with a natural birth and all of that. And my second pregnancy and was technically high risk, having gestational hypertension at the end. And I just hate the terminology. I hate how there's this binary, how suddenly something shifts and it becomes a situation where you're no longer seen as someone who is able to give birth with all of the frills and the Tempur-Pedic mattress and the mood lamps and all of the fancy things that are in birth centers. I just hate how it suddenly shifts into suddenly you are dangerous if you have something that is amiss. So I hate the term high risk, but I'm going to use it here because I don't know another way of saying it. But yeah, so I'm going to get into the more common conditions and then the high risk scenarios if someone shows up to your class, if someone is in that category. But first of all, diastasis recti, that's the first thing that we're going to jump into. And that is the separation of the rectus abdominis, the most superficial layer of the core, that naturally happens to all pregnant bodies. So this happens to everyone, whether or not you know it happens to you. That separation is going to occur. It's really in that fascia between the muscle, the core muscle. So it's the linea alba that starts to separate during pregnancy. And some people can feel it happen. Some people feel more of just like an achy, stretchy feeling. And some people don't feel it at all. But this happens to everyone, as I said. Some people can have a harder time healing from that separation postpartum. So this is something not to worry so much about during pregnancy, although you definitely don't want to do things that accentuate that separation of the core muscles during pregnancy. But postpartum, if you still have that separation of the abdominals that you know and feel in your body, then it's definitely a case where you want to work with a pelvic floor PT before going into all levels group classes or before doing any kind of work on your own to try to rebuild that core, besides diaphragmatic breathing, because that is the one thing that is really safe for all bodies. But during pregnancy, the things that we can do to minimize that separation, one is not to do too little core work, and the second is not to do too much core work. But within that, the type of core work really matters as well. So we don't want to be doing things that work that superficial layer of the core. We want to be working deeper in the transverse abdominis, those muscles that you use to push baby out. So it's still really important to have strength there. But how will you know if you're overworking that core region besides just being able to feel it in your body? Because sometimes you can't when things are moving and shifting and changing day to day. But really how you know is you might start to notice your core is starting to become a little bit more pointed if you're in hands and knees and doing bird dog with one leg forward, the other leg back. You might start to feel some pointedness, or like the core is kind of looking like a loaf of bread. What you want to see instead is a smooth, round surface of the abdomen, this abdominal brace where everything is working together in harmony rather than just sagging forward in the middle. So coning, doming, that is a sign of overworking the core. The second condition that I want to get into, which is something that is really common as well, is back and pelvic pain. So that is kind of a continuum the lower back and the pelvic floor, that everything is really related. Everything in that area is tied into each other, but lower back pain is going to be different from pelvic pain, and the things that you want to do to rehab that pain is going to be slightly different. So I'm grouping them in together, but they are kind of different things. But two things that are extremely common during pregnancy, because during pregnancy you're carrying around all this extra weight in the belly, so it's going to start pinching the lower back. But really what you want to think about mostly is posture, is that when we carry a baby, we're naturally shifting into more of an anterior tilt of the pelvis, meaning that the low back is getting shorter and more pinched, and the belly is kind of splaying forward as there's more weight. But you really want to think of having a nice long spine and moving the spine in different directions to help to alleviate some of that discomfort and to help to come into your center. So really yoga is going to help a lot with lower back pain, but you don't want to move into anything that is going to accentuate that pain. So if things like coming into camel pose or deeper back bends cause more of that pinching in the low back and it feels uncomfortable, then you definitely want to avoid it. Similarly with pelvic floor stuff that's going on, you really want to look out for any kind of pressure in the pelvic floor, especially postpartum. You want to look out for any kind of pain in the pelvic floor or leaking, because those things can happen. Because we are carrying a baby, it makes everything heavier in the pelvic floor. So whether you have a pelvic birth or a belly birth, there still was that weight for so many months that you've been carrying around. So postpartum, it's always a good idea for everybody who has given birth to see a pelvic floor PT so that they can get assessed and know how much things have shifted and get some guidance on how to return to their new, or not return, because you're never going back into the body that you had before, but how to embrace this new body that we have and how to live in a way that is functional without pain, without leakage, without any of those things. So often we hear about doing Kegels, we hear about contracting the pelvic floor to return it to that pre-baby state. That's not always the case for everyone, that you need to be doing a lot of Kegels, especially if your pelvic floor is already really tight, which is generally not the case after giving birth, but can certainly be the case before giving birth. So I, in prenatal yoga classes, never really cue Kegels. I never say that word in a yoga class, because you just don't know what's going on with someone's pelvic floor, especially for people who are first-time birthers. They might have a really tight pelvic floor already, so doing Kegels and doing those contractions might make it even tighter and might make it harder to allow a baby to come out of there. After giving birth, I think it's safer to tell people to contract the pelvic floor to lift up, but that's not the case for everybody. So seeing a pelvic floor PT after giving birth is just a really, really important recommendation to tell anyone postpartum who is showing up to your class, if they ask for that kind of information, if they mention stuff going on in the pelvic floor, in the core, in the lower back, because they can give you more tailored guidance than we as yoga teachers are able to give. But being gentle, watching for pain, pressure, leaking during yoga poses, and backing out, doing things differently if they start to notice those things. Those are good recommendations that we can provide. On a related note, pubic symphysis pain is also really common during pregnancy and sometimes postpartum as well. So the pubic symphysis is that little bridge of the pelvis where the pelvis joins together at the front. And that naturally starts to separate out a little bit during pregnancy. With the hormone relaxin, it starts to allow the pelvis, the joints, the whole body to be a little softer, to be a little looser. So it's natural for the pubic symphysis to separate a little bit, but it can be really painful for some people, and that separation can occur to a greater degree than it's supposed to in some bodies. So that's another case where working with a pelvic floor PT can be really helpful. But In those cases where someone mentions pubic symphysis pain or pubic symphysis dysfunction, that usually in those people, it feels better to stay symmetrical than to do asymmetrical shapes. So when we're doing things like warrior or high lunge, or really anything that is asymmetrical, those are good times when you can remind those people who have mentioned pubic symphysis pain or pubic symphysis dysfunction to stay symmetrical, to do goddess instead of a warrior two, or to do butterfly, or to sit in hero's pose instead of sitting cross-legged. Those asymmetrical movements and shapes can kind of exacerbate some of that pain because it causes that separation to be increased a little bit. So being symmetrical can be really helpful for those people who show up to your class with pubic symphysis stuff that they mention. Sciatica is another really, really common one during pregnancy. And sciatica is a little bit complicated. It's a little bit difficult because it's more of a symptom than a condition itself. So saying I have sciatica is kind of like saying I have a runny nose. It's like, well, why do you have a runny nose? You could have the flu or you could have allergies. So you really don't know what's going on in someone's body if they say they have sciatica, other than they have some tingling going down one leg and probably not the other. That can be increased with movement that they'll probably notice. So when someone says sciatica, you really want to ask them, well, what aggravates the sciatica? What are some things that you know you shouldn't be doing? And we'll try to avoid doing those in the yoga class. For some people, it's walking. For other people, it's hamstring stretches. And for other people, they don't really know. But doing a yoga class, afterwards, they'll come home and they notice that sciatica got worse. So for a lot of bodies, doing hamstring stretches with sciatica is a recipe for aggravating that sciatica. So you want to tell them to be mindful, to be careful, to do those hamstring stretches with a little bit of a bend in the knee because it can tend to pinch that sciatic nerve a little bit more. Pigeon pose is a little bit risky to give to people with sciatica also, because for some people with sciatica, it is the medicine. It is exactly what they need. It stretches the piriformis and it provides the relief that they need. But for others, it really aggravates sciatica. So it's tough. That's something where you really want to check in with them and ask them if they've done pigeon pose before, ask them if they need additional modifications. But yeah, that's why working with a really, really big class can have some disadvantages because you can't really give people those modifications that they need one-on-one. But with any of these conditions, it can be a really good opportunity also not only to work with a pelvic floor PT, but to book some private lessons if that's within their means. Because as a yoga teacher, I know all of these things in my head and I can mention them at the beginning of class when we do a check-in, but I can't necessarily stop the class in the middle and say, hey, this specific pose is going to aggravate you, unless it's something that I really know that I should be telling them in that moment. And that's where I, as a yoga teacher, will change things up and will change the sequence so that it kind of fits everyone in the room. So if I hear someone with sciatica and I was planning on doing a lot of forward folds that day, I might just skip it. But again, it's easier to make those changes if you're working in a smaller class or if you're working one-on-one with people. So if they come with any of these conditions, it's a really good opportunity to mention private lessons as well. Carpal tunnel syndrome is another nerve-related thing that comes up quite a bit during pregnancy. And not everyone mentions this at the beginning of class when we do a check-in in prenatal yoga because they don't always think it's going to be related to the yoga poses or that it's helpful information to know. But as pregnancy goes on, as the body expands, you can start to compress some of the nerves in the wrists. And sometimes it's not just the nerves in the wrist, sometimes it's the nerves in the shoulders as well. So sometimes people think it's just wrist related, but it's actually kind of higher up the chain that's getting pinched. So when someone comes with carpal tunnel syndrome or saying that they have some numbness, tingling in the hands, that's when you can recommend to avoid being on the hands. So avoid being in tabletop, using blocks underneath the forearms, instead in tabletop. Circling the wrist, doing things to release the wrist if that feels good, or avoiding those things if they feel like that's too much. But this is a case where shoulder opening, heart opening, chest opening, those things can also feel really nice, because as I mentioned, sometimes it's the wrist, but sometimes it's that's just the most distal thing that's being affected. But sometimes the problem is really higher up the chain, in the shoulders, in the chest. Maybe they're slumping or slouching forward, because pregnancy can change the distribution of the weight in the chest area as well. And because all of that expansion is happening higher up as well as in the wrists. So that's a case where doing some gentle heart opening, doing some just gentle back bends, opening the chest, that kind of thing, can provide some relief for the wrists as well. Heartburn, so this moving out of the kind of nervy things and the pelvic floor related things and back related things. Heartburn is super common from the second trimester onward, sometimes before, but really second trimester onward. That is a case where it can feel really icky to go into positions where the head is below the heart. So with people with heartburn, we want to remind them to stay upright as much as they can, avoid doing forward folds, be in more of a halfway lift if we do forward folds, and maybe not go down to the side for a side lying shavasana at the end, but maybe be propped up into a supported back bend instead, so that the head can stay much higher than the heart. On a related note, dizziness. So this is completely different, but also very common during pregnancy. First trimester, especially if you do work with people in their first trimester, but really first and second trimester, dizziness can be super common. And the cueing, the modification in yoga classes is the same as heartburn. It's to kind of either avoid inversions or to move really, really slowly when you're transitioning through inversions. So if you're lying on the side, you move really slowly to come first up to a seat and then to standing. Rolling up really, really slowly, one vertebra at a time, not making sudden transitions, because that can trigger some of that dizziness. And usually it's something blood pressure related. It can also be related to other things during the pregnancy. It's never our job to know exactly why someone is experiencing something, but it's just our job to provide those modifications to make them feel better as they are experiencing these things. So really encouraging people to move slowly, which you want to encourage during pregnancy anyways. The other thing with dizziness that you may want to mention is to be mindful during breath work, because with breath work, sometimes people can get dizzy, lightheaded anyways. Sometimes it's just best to avoid some breath work if you are feeling a little bit lightheaded in the first place. So during pregnancy, really, you're not cueing that much. You are cueing a lot of breath work, but you're not cueing breath work that is going to make people feel lightheaded anyways. You're not doing those things that can make people feel like they're hyperventilating, but you never know. You never know what someone is feeling in their body. So you can always tell them, just return to normal, natural breath if any of my breath cueing doesn't work for you, or if it makes you feel dizzy, lightheaded, those kinds of things. Headaches. Headaches can also be really common during pregnancy. So people who come to class when they're experiencing a headache, often I would say, when I work with people who say they have a headache and they're pregnant, it kind of resolves itself by the end of class anyways, because maybe they were doing something stressful. Because pregnancy is stressful, but maybe something stressful was going on before class and they're able to take their mind off of it and it goes away by the end of class. But that's not true for everybody. So headaches, if someone comes to class during headache, make sure they know that they can be in restorative poses the entire time if that's what feels best. If you work in a place that has eye pillows, that's even better for headaches. You can place an eye pillow over their eyes, set them up in some restorative poses, and that is really beneficial. But just allow them to move at their own pace, kind of similar to the dizziness, lightheaded, heartburn stuff. Allow them to move slowly, transition slowly, Sometimes avoiding inversions also can be helpful during headaches. Sometimes they can feel really good. So give them the freedom to know that whatever they're feeling in their body, go with that. Insomnia. Okay, so this one might actually be the most common thing that I see anyways with people in the third trimester, because I'm mostly working with people in their third trimester during prenatal yoga classes, but almost everyone who comes to class has some kind of issue with sleep during the third trimester. It's definitely something I experienced, but almost everyone, because you are growing a baby, your body gets super uncomfortable, and it's also the excitement, the anticipation, the not knowing what to expect. Even if this is your second, third, however many babies, it's a big transition. So you get really excited, or a lot of people do, about what is to come. So it can be really hard to sleep. So doing a yoga practice is really great. So great for people who have insomnia, because it can take their mind off of the stress and it can allow them to move their body, to get out of their head, set them up for sleep. But this is where doing restorative poses can be really helpful, especially towards the end of the practice. This is where teaching some gentle breath work, diaphragmatic breathing, alternate nostril breathing, that can be really helpful as well as yoga nidra, because that is the yoga of sleep. So teaching them an easy to do sequence. I don't want to say sequence because it's not really a sequence, but it's a sequence of meditations essentially that lead into a very long meditation practice that you can do as you are falling asleep, and that you can do to gently coax your mind into sleep. So teaching yoga nidra is also super important and super helpful for anyone who has insomnia during pregnancy or who just has some difficulty sleeping. So some people, a good number of people, also wake up with charley horses or cramps in the calves at night during pregnancy. This can happen. It doesn't happen every night to every person, but I definitely experienced it a couple of times with my first pregnancy. And so charley horses, that's when you're kind of probably have overworked the calf muscles during the day, maybe didn't hydrate enough, maybe sometimes it's something nutritional, that you haven't had enough potassium or magnesium or any of those things. But regardless of why those calf cramps are happening, they happen a lot during pregnancy, especially in the second-ish trimester. And so the treatment for that is to massage the calves and stretch the calves before going to sleep. So during yoga class, you can show the people who are coming to class how to stretch the calves and how to do a gentle self-massage of the calves, because that can be really helpful for that. As well as the general reminder to stay hydrated during the practice and after the practice, because that is something that we can do as yoga teachers too. Okay, so swelling or edema can also happen for a lot of people during pregnancy. If there's a lot of swelling and if it happens really suddenly, then this is a good excuse to call your doctor, to call your medical provider and let them know that that's going on. Not a case to be asking a yoga teacher about what to do. But if it's just kind of a slow, gradual swelling, that can be really normal. Swelling in the hands as well as swelling in the feet. Most people experience it in the feet. But what we can tell those students who come to us with a little bit of swelling to do is to do a gentle inversion, like legs up the wall, if they're still comfortable lying on their back, or a side lying legs up the wall. That can be kind of tricky to cue students into that in a yoga room. Sometimes it's easier to do that with like a birth ball or with a stack of props underneath the leg that is elevated. But it can be a really important one to teach to students who are later on in their pregnancy and who are experiencing some of that swelling. Those inversions can be really helpful, as can foot massage. So just like that calf massage that I mentioned for calf cramps, foot massage can be really, really important for swelling and for edema in the feet. And it can just feel really, really nice towards the end of pregnancy when we're on our feet and when our bodies weigh more and it's just putting more stress down on the feet. Having someone to massage our feet or learning to do it ourselves can be really important. Okay, so the last pregnancy related thing, that people may mention is Braxton Hicks. So this is really common for second time pregnant people up to, however many babies they have. It doesn't happen as much with first time pregnant people, but I definitely experienced it a lot with my second pregnancy. Didn't experience it at all with my first pregnancy. Braxton Hicks is nothing to be worried about. It's completely normal. It's just the body preparing itself for contractions. So it's just like, some people call it practice contractions, but it's a sense of the belly tightening. And this, what I really notice, can happen when you are dehydrated or when you have been on your feet more, when you've been a little bit active. It's your body telling you to rest. So what I found to be really helpful and what I hear is helpful for others is to lie down, to give yourself a break, to hydrate. Hydration is super, super important for Braxton Hicks, and just to rest. So if someone comes to your class saying that they are experiencing Braxton Hicks contractions, which that's happened to me a couple of times. I've had people come to class saying, I'm having Braxton Hicks, what should I do? Tell them to move slowly. Tell them to move at their own pace. Tell them to stay hydrated and to take care of their bodies. Set up in a restorative pose and do that the whole class if they need to. Now, it is sometimes important to tell people the difference between Braxton Hicks and real contractions, because sometimes that can be a little bit concerning for some pregnant people. So if the contractions feel like they're just a sense of tightening, like they're not super painful, but it just feels like a sense of tightening and it's kind of random when it happens, that's usually Braxton Hicks. If it is progressing, if it is coming rhythmically at a set interval and progressing, getting more and more painful, then that's kind of more like what actual contractions are. So that can be sometimes important information for someone who is pregnant to have, especially if they don't know it already, and especially if they are kind of concerned about what this tightening that is going on is in their body. So that list was not exhaustive at all, but those are kind of some of the really common complaints, discomforts, aches, things that come up during pregnancy. The other one that's kind of high risk, but also kind of normal, is breech. So a lot of people before 32 weeks or so have a baby that is in breech, and that is entirely normal. It's entirely normal for the baby to kind of swim around in there and move around and be in different positions before they get settled into a head down position. So if someone is in their third trimester and they're getting concerned about the positioning of their baby, this is when it's really important to refer them to Spinning Babies. Spinning Babies has so many resources about positioning, and honestly, a lot of it is very yoga-ish. So really doing prenatal yoga and staying mobile, doing all of those things that you need to do, going for walks and staying hydrated and just moving your body in a way that feels comfortable. Those are the things that you need to do to allow baby to turn to the head down position. But Spinning Babies has some more kind of tailored movements that are specific to flipping a baby, to turning a baby if it gets to those 32-ish plus weeks and it seems like baby is still head up. Now, for some bodies, babies are really wise. And for some bodies, baby is just in that position because that's the position that baby needs to be in. So sometimes it's a lesson of acceptance and letting go and being comfortable with where baby is, because maybe it is something that is structural, that is anatomical, that is causing baby to be where they are. So knowing that sometimes baby knows more than we do is something really that is powerful to mention if someone is getting close to the end of pregnancy and baby is still in breech and they're really concerned about that. Sometimes just allowing baby to be where they are and being okay with it is the medicine that people need. So breech is technically high risk, but it's normal also. Oh, one more thing that I forgot to mention with the common pregnancy related stuff that comes up. So perinatal mood disorders. This is very, very, very common, especially in the postpartum period. And I don't want to finish this episode without talking a little bit about that. It's hard for people to talk about these things, I find, because there's a lot of shame and stigma around depression, not so much around anxiety anymore, but around depression and around clinical anxiety and around psychosis for sure, which is super rare, but people don't really talk about these things when they come up. I do have a lot of people mention to me in prenatal yoga classes having some anxiety that they deal with, because anxiety is really just the human experience these days, I think. I think everyone who shows up to the yoga mat has some degree of anxiety. That is something that I see across the board, not only in prenatal yoga classes, but in every single class that I teach. Anxiety, I just see it everywhere. It's really common. It's the world we live in today. So that is the whole purpose of doing yoga, really. A big purpose is to provide people with tools to cope with anxiety. And everything in yoga helps with that. So I can't really say that there's one thing, because for different people, it's different things. But it's often the practice of moving slower, of being mindful with our bodies that can really help. Postpartum depression and the emotional experience of postpartum, that is something that is so common as well. And it's something that is not talked about enough. I know I had a postnatal yoga workshop that I did a couple of months ago, and the entire first half of class, we were just talking about the emotional experience of postpartum. So know that it is real. It is real, going through that transition of being one body to two, and of suddenly having to care for someone who has so many needs, but you love so much, is a really complicated thing, as well as the dynamics that it brings about in the relationship. Suddenly, everything in your relationship changes if you had a partner. So having a place that is safe to unpack those things can be really helpful. And yoga is not always the place for that. Sometimes it is. Sometimes we can have a check-in time where we talk as a group. And sometimes, you can be there as a yoga teacher for someone who just needs to vent, and you can just hold space for that, especially in smaller group lessons or private lessons. That can happen. Crying on the mat, that can definitely happen. But it's not our place as yoga teachers to be a therapist. So that's when it's a really important place to refer out to therapists, because everyone could use a therapist, to be honest, especially in the postpartum period. So if people are receptive to it, open to it, having some recommendations for therapists is super important, as is creating community. So creating ways for students to stay in touch, whether prenatal or especially postpartum, is really, really, really important. And sometimes it is just being there as a yoga teacher and holding that space for people to meet each other and to build those relationships. So that is so important for perinatal mood disorders. Okay, into the actual more high-risk stuff. So all of the quote high-risk conditions, which, as I said, I hate that term, but for the high-risk conditions, those things that make pregnancy a little bit more dangerous, as some people feel, it's not our role as yoga teachers to tell people how to move, but there are sometimes with some of these things, some advice that we can give. And the common theme in all of that advice is to move slowly and to listen to our bodies. That is the number one thing for not only the higher risk conditions, but for every single human who shows up to a yoga mat, is to move slowly and to listen to your body. But if you are a yoga teacher, and especially if you are a prenatal yoga teacher, you will get high-risk people in your class at some point. And that can be a very wide range of conditions. High risk can mean a lot of different things. Gestational diabetes is one example where the cutoff for gestational diabetes is pretty low, and it doesn't really impact the yoga practice very much, other than, people should just make sure their blood sugar levels are okay during and before class. So allowing them to snack a little during class, before class, allowing them to stay hydrated, that's super important. But some of the other conditions like gestational hypertension, which I experienced, and the next step in gestational hypertension, which is preeclampsia, likely you're not going to be seeing anyone who is in HELP crisis, who is, beyond the level of preeclampsia and, about to have a seizure, that kind of thing. But you want to be prepared for those kind of things if they do happen. And how do you be prepared? I don't know. Sign up for a CPR and first aid class, just have the basics of those kind of things in mind, just in case some kind of crisis happens. But, allowing those people to have the permission to slow down, to rest, to stay hydrated, and to listen to their bodies. When I had that diagnosis of gestational hypertension, which I only had for really 2 days before the induction, but when I did, and when I knew that was something that was going on in my body, I still went to my prenatal yoga class. I didn't really do much different. I was still able to move around like the rest of the class, but I just moved a little more slowly in my day-to-day life and in my own practice, because I could feel my heart beat faster. With hypertension, we don't often feel it in our bodies, but I definitely felt my heart beat faster, and I felt myself getting more winded when I would move around and things. So reminding them to move slowly is very important. I've also had people who have been diagnosed with preeclampsia still showing up to the yoga class like the day before an induction. So that really does happen. So those reminders to stay in touch with their body and to move slowly are just so, so important. I can't stress it enough. The other kind of high risk conditions that we might see are multiples, so having twins. We may see people in our yoga classes who are growing 2 instead of 1, and really there aren't many cues or modifications as yoga teachers that we need to know about for that. It's just to be careful, to move slowly, all of those things that I already mentioned. Placenta previa is another one. If someone has placenta previa, they're often being told not to exercise, so they might not even be going to yoga classes to begin with. But some people just have a lower lying placenta, which they'll be told about that if they do. And kind of the thing that we want to know as a yoga teacher is to not tell them to go into squats, which is kind of funny because not everyone knows that you're not supposed to go into squats if you have a low-lying placenta, but that is actually one of the contraindications. So that's why one of the reasons that I don't cue a lot of squats in my yoga classes. We do them sometimes, but I kind of go around the room and make sure everyone is comfortable in a squat before we do it, and offer a lot of modifications, because for people with a low-lying placenta or a breech baby or hemorrhoids or pelvic floor pain or discomfort, squats can be really uncomfortable. So, I do cue it, but I offer a lot of nuance and caution before just throwing people into squats before we do them. Some of the other higher risk things that might come up, obstetric cholestasis, which is where it's a liver condition that can happen during pregnancy and where someone can suddenly become really, really itchy. I've had a yoga student with that before, and I know it's not fun. It was one of those cases also where she was about to go in for an induction about a day after the yoga practice, but she had just been diagnosed with obstetric cholestasis, and there's nothing really that we can cue as yoga teachers except for relaxation, which can help with itchiness. Believe it or not, it helps me when I was massively inflamed with poison oak. Meditation and visualization and that kind of thing was about the only thing that really helped with the itchiness. Hyperemesis gravidarum. That's another thing that's not really high risk, but it is definitely a condition that people can show up with. And that's not as common, but can lead to higher risk conditions. So it's where someone continues to experience the nausea of first trimester through the entire pregnancy. And it's not just nausea, but also a lot of vomiting. And I have worked with people also who have had this condition. And it's really hard to see someone who is constantly vomiting into the end of the 3rd trimester. Sometimes nausea and vomiting does happen towards the end of the 3rd trimester. It'll come back, but for some people, it just never ends during the pregnancy. And that's a case where they might be going in to their provider and getting IV infusions to stay hydrated. And so there's nothing really that we can offer as yoga teachers besides to tell them to move slower, because moving quickly and not staying hydrated and that kind of thing can make some of that nausea worse. But always having an open door policy where they are welcome to leave the room at any point during the class. No questions asked, because people during pregnancy have to pee a lot. They might have to vomit. It happens. So allowing for that open door policy, because people have additional needs during pregnancy for sure. So that is really it. That list, as I said, was not exhaustive at all, but we kind of talked a lot about the more common aches and pains and things that come up during pregnancy, as well as some of the higher risk conditions, the things that might happen. Some of them. There are many, 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 but I'm just speaking from my experience, the things that I've seen as a prenatal yoga teacher. So there's a lot more. There's a lot more that I didn't mention, but if there is something that I didn't mention, let me know. Let me know your experience with it. If there's something that I did mention and I didn't mention some of the modifications that you know have helped you in your pregnancy, please let me know as well. I love to learn, and I love to keep adding to my list of tools that I can offer to people who show up to my classes. So let me know. That's about it for today. Please do like this video, subscribe, rate it 5 stars on Spotify, leave a review, do all of those things, support on Patreon. I'll have the link below so that you can sign up on Patreon and support. But let me know what you'd like to hear more of. I'd love to hear from all of you, and I will see you next time.